Hello, dear viewers. Today we discuss a case of an impacted maxillary canine which was pulled out orthodontically. The patient, who was in his late 30s, came to us with a mobile tooth in his upper jaw. He was aware that it was a milk tooth. We did an OPG which revealed that there was a permanent, fully developed impacted canine with no pathology. As visible, the tooth had an improper path of eruption, which could be the reason for its impaction and hence the retention of the milk tooth. We have been using this term impacted. What does impacted teeth mean? In basic terminology, it is those teeth that fail to erupt even after their complete formation. We all know about impacted wisdom teeth, and many of us have had to bear with the discomfort that they cause. Just like that, there could be other teeth that may be impacted. Maxillary canines are the second most common impacted teeth after the wisdom teeth. A thorough clinical and radiologic examination was done. Clinically, as seen in the first picture, the lower tooth opposing the upper deciduous retained tooth was slightly buccally placed with an end-on relation with it. And as evident in the second picture, the patient had severe deep bite with no show of the lower anterior teeth at all. Radiographically, we went ahead with a 3D CT scan to analyze and study the impacted tooth in detail. We could see that a complete formed canine was palatally placed. The root of this tooth did not interfere with or was seen damaging the roots of any adjoining teeth. On basis of the evaluation, we discussed two treatment plans with the patient, along with their pros and cons. In the first plan, we could go for extraction of the milk tooth and the impacted tooth and replace it with an implant. The main advantage of this plan was that it would take less time. But the disadvantage was that the crown of the implant would not have been in proper occlusion, and for correcting that, the lower tooth would have to be modified. In the second treatment plan, we could go for orthocorrection, in which we would have pulled out the impacted tooth and correct the severe deep bite of the patient. The main advantage of this plan would have been that no other good tooth would have been affected, and also the other malocclusion like the deep bite would have been corrected. The main disadvantage was that this plan would have taken time. After the patient's consent, we went ahead with the second treatment plan. The impacted tooth was surgically exposed and a button was placed on it. We retained the milk tooth for aesthetic reasons. As the forces were being applied, we can see that the tooth is moving away from the midline towards the ridge. Downward and outward forces are being applied, and here we can see that the tooth had been exposed. The deciduous tooth got dislodged, so we removed it. As we had seen in the X-ray, the canine was rotated. So once the crown was exposed, we had to apply derotation forces to properly align it. Here we can see that the impacted canine has reached the ridge completely, and now it has again been derotated. Finally, the impacted tooth was out and properly aligned. Time taking as it was, but the results were worth it. Not only were we able to get the impacted tooth out without any damage to any adjoining teeth, we were also able to correct the crossbite of the canine and the lower premolar, bringing it in proper occlusion, and also the severe deep bite of the patient.